Okay, all right. Good evening to everyone. First of all, I'd like to do a special thanks to the panelists in taking time out of your busy schedule to provide communications and education of COVID-19 vaccination to the community. Thanks to the Minority Health Alliance board and leadership to have the vision to sponsor this webinar. Executive Director Lisa Washington and Board President Willie Stroman. It is greatly appreciated to have Omega Psi Phi Fraternity Incorporated, the new chapter, to co-sponsor this webinar. It fits the 4 fundamental values of manhood, scholarship, perseverance, and uplift, principles of the fraternity. Special thanks to IMHC representative Erica for her technical expertise in providing all the guidance to make this webinar possible. Now, at this time, the man of the hour, Mr. John Grant, our moderator, radio personality here in Kokomo, Indiana, the founder and owner of station 104.9 FM WTSX. Mr. John Grant.
Good evening, everybody. I'd like to thank you for taking out the time again to join us on this very important cause. We have an esteemed panel that I would like to introduce, and what their purpose is in being on this webinar and how it could be essential to our cause. I'd like to introduce to you on our panel, Dr. Lance Washington. He has a great patient experience in this genre that we're seeing now, where we're trying to get people of color to understand what the vaccine can do for them versus what the disease can do to you if you don't have it. Dr. Emily Baker, she is going to compare local versus state data for us. Dr. Jeffrey Breckenridge, personal experience with the virus. He has some that he can detail on. Dr. Devona Anderson, she has also patient experience. She's on the call with us. And Pastor Reverend Dr. William J. Smith, personal experience of the viruses, and that can help us get to a place where we can understand how do we get people in the community, especially people of color, to believe in this vaccine, to have faith in it, and not to run from it with conspiracy theories, because while the conspiracy theories form, we are being attacked by the virus. So we're trying to eliminate the attack and increase the education. The purpose, we want to go over some potential issues that may surface. We want to know the purpose of the vaccine and its benefits, any history of it, the impact of contracting the virus. We want to talk about Pfizer versus Moderna versus Johnson & Johnson, if there's any discussions of that. And then we'll have some Q&A between all the panelists once we get started. So the first thing I would like to get into is just to get Dr. Washington, if you're on the call, you're seeing patients. Have you seen patients with the virus, and how have you been treating the virus since the vaccines come out?
Can you guys hear me?
Yes, sir.
Okay, I just want to.
Doc, before you get started, we need to introduce the mayor, John.
Yes.
Oh, I apologize. Our esteemed
That's
guests.
okay.
I'm sorry.
That's okay.
Our esteemed guest, Mayor Tyler Moore of City of Kokomo, Indiana. Is that incorporated?
The federal government's trying to decide now whether it's a metropolitan or a micropolitan, but
well, we're all about monetizing here, so okay. Mayor Tyler Moore is on here too, man, and coming from a municipal situation and what he's doing with the police and how they're staying safe and how they're getting vaccinated. We're going to talk with him more about that. But again, thank you for joining us, Mayor. Dr. Lance Washington, as a physician in the area, what are you seeing out there since the vaccine has come upon us in the county?
Brother Grant, thank you for, first of all, inviting us and allowing me to be in this forum. I'd just like to acknowledge and say hello to all my colleagues, including Dr. Jeff Breckenridge, Dr. Emily Backer, Dr. Devona Anderson, and my attorney brother, Willie Stroman, and of course, my pastor, Dr. Smith. It's been a conundrum. Just most of you know I'm an internist and I wear many hats. 50% of my practice is outpatient primary care, and then the other 30 to 40% is I do hospice. I'm a hospice director, and also I'm the medical director of Kokomo Healthcare Place. It's been crazy since the vaccine. I have not directly taken care of any patients who've actually had any true illnesses after getting vaccinated. I mean, I've had 0 patients, which is what we would expect in terms of the immunity that they have. But we're seeing COVID-19 complications. This is even in patients who had COVID a couple months ago, even if they got vaccinated. And so we're seeing some post-COVID-19 symptoms. I'm sure my colleagues can speak to the PEs, that's a blood clot in the lung, or what we call post-COVID brain, especially if you had the fatigue, changes in sensorium, which means it's like the way in which you think. So I haven't seen anyone directly who had the vaccine who's got, and I think Brother Grant, I'm answering your question, who had the infection again. I'm still seeing plenty of COVID-19 infections in people who have not been vaccinated.
Okay. Well, my next question will go to the mayor, Mayor Tyler Moore, running the city and keep making sure that the first responders. How did that go about with the flow of the vaccine with the first responders and then people that have immediate contact with other people that work for you? How did the vaccine distribution go with you? Did it go well?
Sorry about that. I checked. Yeah, obviously with the leadership of the Howard County Health Department and Dr. Backer and James Vest and Christina Summers and those at the Department of Health, the distribution of the vaccine has been a well-oiled machine. I have not heard one complaint, one problem with the distribution of the vaccine out at the event center, anything at the hospitals and such. I myself actually took advantage of the distribution out at the event center, and when more vaccines became available, dialed into the 211 site. And so folks that are electronically challenged or a little hesitant on making the appointments online at the rshot.in.gov site are encouraged to call the folks at 211. They were very receptive, very professional, and it was a great experience with that. So I think everything that we've done here in Howard County, again with the leadership of our county commissioners and the Department of Health, making the distribution available, has been wonderful. And the amount of volunteers, not only from the hospitals and from the community, but from IUK and Ivy Tech, those nursing students that have volunteered and assisted, have made the experience very easy and I mean, really a wonderful experience.
Okay. All right. Well, Mayor, we appreciate your participation in the whole program. And how many sites do we have, Mayor, right now that people can just walk up to and get a shot?
The walk up, and then I may defer to Dr. Backer as well, because I know the Department of Health is intimately involved with those sites. I know for the public right now, the event center is the largest distribution walk-in center, and they encourage the folks to register for an appointment before. You can still, I believe, at Meyer, at CVS, the hospitals, I believe, are just providing those to their patients or first responders, or even those in the educational field. But Dr. Backer, you could probably give a little more insight as to some of the other walk-in type of clinics.
Sure. Pretty much almost all of the major pharmacies in town, they all want you to schedule appointments, but then yeah, at the event center, We have appointments, we have clinics on Wednesday, Thursday, and some Saturdays. And then St. Vincent's Ascension still has a clinic several days a week there too. So there are many, many sites that have openings over, in Kokomo and Howard County.
Okay. Well, Mayor, we'd like to thank you for your participation. We know you have to go. And in fact, Dr. Backer, we could just stay with you. I have some questions
Sure.
for you.
Well, no, I appreciate being asked to come in, and really part of the importance, as you can see, I'm in my vehicle. I'm actually out at a tennis match. And so the more we continue to vaccinate, and we can have events like this where our kids continue to participate in sports and that we're able to gather. I mean, yes, there's folks close by, wearing masks as well. But I mean, the more we continue to stay ahead of this and all participate and be respectful with mask wearing and social distancing as we continue to navigate through this is wonderful. So again, I applaud this, as I mentioned offline before, this dream team that was assembled here to get the word out to the folks in our community. And I applaud you all for your efforts here on this, and as well in your own rights professionally and your clinics, offices, and churches. So thanks for all you do. God bless.
Thank you, Mayor. Thank you for joining us. Okay, Mayor Tyler Moore, ladies and gentlemen. So we're here to talk about actually, how does this, we have this stigma in the African-American community about vaccines. Okay, Dr. Backer?
Yeah.
And I'm talking to Dr. Backer. And some of it stems from even before I was born, the Tuskegee experiment.
Yeah.
If we could talk about that, I mean, there was a plan for us to be tested for a cure for syphilis, I believe, right?
Right. It was, yes, it involved syphilis. Yeah.
It involved syphilis. And prior to them finding the cure, we were getting tested, and so many other infections were put upon us to try to find the antidote. A lot of us died. All we hear about is the part that died.
Right.
I want to talk about, now I want to bring it back to where I started to go to school, where immunizations was, you had to get immunized. You had to have the polio, the measles, right?
Yeah.
The flu. And I'm trying to talk to my brothers and sisters, like, we had no problem taking those shots.
Right.
Right. Okay. But here's their argument. Well, those vaccines were in studies for years. And I beg to differ. I did some research on that. When smallpox broke out in the 30s, they had a vaccine ready to go in the same amount of time this vaccine went in. Yeah. About 1 year and 8 months.
Yeah.
So, but we don't do the research. And we're looking for people to tell us these differences and information. Okay. And I'm so glad that we're in the internet age, because if I could look this up, somebody else can look it up, right?
Right.
How do we increase the intelligence amongst our people to the point where we believe that this is something that's going to help us?
Yeah. Well, one thing, like you said, I would bring up that a lot of people say, oh, these vaccines are too new. They came to market too fast. It's not safe. One thing to realize, you can look this up with the mRNA vaccines. Okay, so that's the Pfizer and the Moderna. Those, yeah, they came to market very quickly, but the research is over a decade old. Because I don't know if you look back, there was SARS in 2003, there was MERS in 2007. These were very similar. So the research for these vaccines actually started way back then. So it's not actually that new. It's just that we didn't actually have a vaccine that was, marketed, or that actually made it to market. And, necessity is sometimes the mother of invention. Those outbreaks were limited to very small parts of the world. They did not affect a lot of people. And at this point, when everybody saw how this is spreading, we're like, yeah, we need to move this research along. But the point being that it's been around for a while. So this is not as brand new as people think it is.
Okay, and I have one more question for you, Dr. Backer. Do you have any data right now as far as the state of Indiana versus how many people locally are participating and getting one shot versus how many people in the state are still lagging? Is there controversial data there?
Well, right now, I do have that data. It looks like, and I think this is a Friday. So about 1.5 million people in Indiana are fully vaccinated. So that's about 29% of all eligible Hoosiers. Obviously, you have to be at least 16 to get a vaccine. So we're at 29%. In Howard County, about 17,000 people are fully vaccinated. So that's about 26%. So we're a little bit behind the state. The key to realize is, our goal, and my goal as a public health officer, is to get enough people vaccinated so this stops. And you've probably heard that term, herd immunity.
Herd immunity, yes.
And so, the numbers get bounced around, but it looks like we probably need about 75 to 80% of people to be immune, either through vaccine, possibly through recently having the disease, but we need about 75 to 80% of people immunized, basically, before this stops. And I think that's why, from a public health standpoint, we have such a push to get people immunized and get them immunized as soon as possible, because the quicker we get more people and a higher percentage, the quicker this stops, and the longer it goes on, the more people get sick, the more people end up in our hospitals, the more people end up, with long-term COVID symptoms, so that's why there's such a big push from our part. Now, as far as the 2-dose versus the 1-dose, I'm sure you're aware, the Johnson & Johnson vaccine, which is the 1-dose, is temporarily on hold. The ACIP, which is the national governing body of immunizations, looked at the data. They want to look at it for another 10 days or so. So what happened is about exactly 6 people out of 7 million doses, and this is the 1 shot, had a rare blood clot in the brain. They were all women, they were all white, and they were all between the ages of 18 and 48. Now, they don't know, obviously we don't know that it can't happen in men. It's so rare right now. But it's thought that it may be related to the vaccine, to be perfectly honest, because it is a very rare condition where someone gets a blood clot there's a big vein called a sinus in the base of your brain. It does occur in people in general, but very rarely. And it looks like it might be slightly increased in those that have had the Johnson & Johnson vaccine. So right now it is just on hold, under review. Obviously, a lot of people had gotten the Johnson & Johnson vaccine in the last 2 weeks. So I think that's kind of what they're looking at to see, okay, how many more of these cases come in? I think the most important thing to realize is too, is that the CDC is being very transparent about this. I mean, you can look up all this data online that, I was in a call Friday and where they gave us all the details and the data. This is what's happening. This is what we're looking at. The Johnson & Johnson is similar to the AstraZeneca vaccine. And that one's not available in the US. That's the one they're using in Europe. So they're a similar type of vaccine. And they have also seen some issues with the clotting. Again, they're extremely rare. One thing I will mention is that there have been exactly 0 cases of this with Pfizer. There have been 3 cases of blood clots, not exactly the same as this, with the Moderna vaccine. But I would mention that if you look at totals in the United States,
it's less than 100,000 of a percent.
Yeah, it's less than 1 in a million. And so right now, 98 million Americans have gotten the Pfizer vaccine and 85 million Americans have gotten the Moderna vaccine. So like I said, on the CDC call, they said 3 people may or may not have clots related to Moderna, and 0, there were actually 0 cases related to the Pfizer. And those are those 2 like mRNA vaccines that are a little different, and they are a 2-dose series. And like I said, I expect they probably will bring Johnson & Johnson back, but they may restrict it. They may say young women can't get it, or, only those over 65. I think, and the other physicians may know this, I don't know, I think they've restricted AstraZeneca in some other countries to those over 50. I can't remember which countries exactly, but for the same reason. And like I said, those are both, they're called adenovirus vector vaccines. So they're kind of similar. So they're looking at the same thing. But I think one thing for the whole community to realize is that they are trying to be very transparent about this. I think that, the temptation would be to say, oh, this only happened to 1 in a million people, it's probably not a big deal, let's let it slide. But they're not, they're being very open about this. So which is incredibly important, I think, for people to trust. So.
Well, thank you, Dr. Backer.
Excuse me. I think it's also important to stress that it's not just in general blood clots. It's blood clots that are related to low platelet count,
Yes.
and the people test positive for an antibody against heparin, that as if they had received heparin. And so it requires a very specific treatment. That's why this is such a rare anomaly. If you come in with a blood clot, you might get heparin. However, with this particular disorder, which has been related to the immunization, getting heparin could be even more damaging. And so there is a blood test for it if you get bad headache or severe abdominal pain within 6 to 13 days after your Johnson & Johnson shot. You can get the blood test to be tested for that. And we need to get that message out too, that early intervention for that can save your life if you have,
You know, Dr. Breckenridge, I was just going to come at you and ask you a question. In your practice, with somebody that has already severe medical issues, okay, high blood pressure, diabetes, things that affect the community of color, okay, do you stress that they get an examination before they take any of these vaccines, just to see if they have any adverse effects from it?
I have not done that. I at this point, I don't believe that there is a contraindication of them getting the vaccine. Now, some people with autoimmune disorders like lupus, rheumatoid arthritis, they have had flare-ups of their autoimmune disorders after vaccination, but the risk of them getting COVID-19 is so much higher than what can happen compared to the vaccination. I encourage all of them to get vaccinated at some point without a physical examination.
Okay, all right. Dr. Breckenridge, I have one more question for you. Do you have any data versus the population of colored or people of color people getting vaccinated versus everybody else in the state of Indiana? What's the data of us getting vaccinated versus any other group and the amount?
Yeah, I don't know the exact numbers. I do know our numbers are lower. And as Dr. Backer was saying, part of that is the Tuskegee effect. We have an acquired reticence about vaccinations, particularly vaccinations that are sponsored by the federal government. We had a similar problem in the 70s when swine flu came out, and President Gerald Ford, along with Dr. Jonah Salk, together stood on stage and recommended everybody get vaccinated for swine flu. And then later that year, anybody who had a heart attack or a stroke wanted to blame the swine flu vaccine, even though it was not distinctively higher than the general population the year before. And so whenever the federal government puts their hands in something, there's always going to be, tongue in cheek on the part of the public. However, this vaccine is very safe. 90% of doctors and healthcare providers have been vaccinated in our country. And if anybody would have been suspicious of a conspiracy to get rid of our population, it would have been us, and would have not taken the shot. And so I took my shot willingly. I would have taken the Moderna. I wasn't given a shot choice. I went to the hospital. They gave me the Pfizer. I would have taken the Johnson & Johnson shot had it been offered to me. I did not have any fear of it. The AstraZeneca shot, as Dr. Backer was mentioning, has had much more problems in Europe, particularly Germany and the UK, and they have restricted it to age 55 and older. But I would have taken the Johnson & Johnson shot with no problems. Okay.
All right, Dr. Breckenridge, thank you. Dr. Devona Anderson, hello, how are you?
I'm good, how are you?
I'm great. It's a pleasure to see you, pleasure to meet you. How you been?
You too, I'm good. I did want to mention about Dr. Breckenridge saying he would take the Johnson & Johnson. I did take the Johnson & Johnson vaccine. Okay. And it was powerful. I didn't feel well for a couple of days. I had fever and everything, but I just, knowing the way the body works, I knew it was my immune system kicking up and, getting ready, just in case. But the chances of getting that blood clot disorder, from the Johnson & Johnson, you have a higher chance of getting struck by lightning. So I'm like, it's only 6 in 7 million people receive the vaccine. Yeah. so I didn't have any fear about the vaccine at all. That about the Johnson & Johnson in particular. I did have some trepidation at the onset, like maybe back in December, about the vaccines because it was just new coming out, and I'm usually with any kind of medication wanting to just watch and see what happens. But then, as time went by and realizing that as each week goes by, each day goes by, millions of people are getting the vaccine. And so it's different from just studying, they have the studies and they'll study maybe 10,000 or 20,000, 30,000, 500,000 people in the study. Now we have millions every day who are getting the vaccine. And so you get a larger population, a larger sample, and you can see, what is going to happen in more people, more ethnicities. And so, I agree with all the other physicians, it's safe for us to take. And I'm sure someone will speak to this later that I'm not sure how long it's gonna last. I don't think anybody really knows how long immunity is gonna last. And so I think even with the vaccine, we have to continue to keep our precautions up, wearing masks and things like that. And the CDC website says that if you've had the vaccine, it's okay to be in a room with someone who is unmasked unless you are high risk. And so, or have a risk. Now, one of the risks is if your BMI is over 30. So, and how many people do we know if your BMI is less than 30? 30 is obesity. And so most of us have a BMI over 30. And so that means everybody still needs to be wearing a mask indoors. And so that's just my little soapbox issue. But Johnson & Johnson was fine. I wanted Moderna or Pfizer, but like Dr. Breckenridge, I didn't have a choice, and I went to the site. They said, well, we only have Johnson & Johnson today. And I just took it.
Okay, so here's my question, Dr. Anderson. Now, I have two questions. First of all, I want to mention that Dr. Fauci was on television the other day. He stated during a congressional hearing that this is a public health thing. There's some people that are worried about, well, this is going to restrict my liberties. Do I have to take the shot? Do you feel now that we're getting 4 to 5 million people a day getting vaccinated, we're behind in Indiana. Do you feel, number one, do you feel that we should push the Johnson & Johnson because you can get people in and out real quick? They don't have to come back and think about it. Or do you think that we should find out the restrictions? Because he said that they'll bring the Johnson & Johnson back, but they'll bring it back with restrictions. People over the age of 55, people. And the other thing you got to understand is this. What's the population difference between the young population, people under 30, and people over 30 in the state of Indiana? And who is more asymptomatic? Should that be more scheduled to have a vaccine faster? And I would think the young people want to get in and get out. They might not know the history of why African Americans are susceptible to not taking it. They might not even care. But how do we get them in and get them out? Because they are the majority of the state. Do you have any insight on that?
I only have my opinion.
I was gonna bring Yo Gotti here to do a concert, just stick everybody at the concert. But the man probably wouldn't like that.
I mean, my humble opinion is that whatever vaccine we can get, that we should be giving it, because the longer the time the vaccine is out there, the more people that have it, the more chance we have of more mutations and more variants and this vaccine mutating to get around our vaccines. And so we have to get them in the arms of people and get it in quickly and get people immune. So my opinion is that like any vaccine that we have, like I said, 6 out of 7 million, that's not very much at all. It's
not very much. Okay. I got one more question. I'm going to go back to Dr. Lance Washington. Dr. Lance, are you with us? Dr. Washington?
Yes, I'm here.
What is the study with the vaccine amongst juveniles through kids? Do you think they did enough testing to find out if these vaccines are effective? And do the kids need a booster shot? That's what they're saying. Even with the Pfizer, the Moderna, not the Moderna and the Johnson & Johnson, they're stating with the Pfizer that because of the new variants that are coming out day to day and they're doing testing on that, the children their study has not come back yet on what reactions they have to either or of the vaccines. What's your take on that?
Okay, that's just the audience. That's a very, very, very loaded question. and I'm going to bring in Dr. Emily and Dr. Devona on this. But to your question, right, to just, if I'm answering your question right, the information that they're already studying kids, especially Pfizer, down to the age of 2, I believe, and not 6 months. I have to repeat myself. I have to look that up.
Okay.
That data will be available theoretically by Christmas. Dr. Emily, she quoted a few things. We need everyone to take the vaccine. We need herd immunity. We need 70 to 80% at least. And I use 70 to 75 as my magic number of the number of people who need to be immunized. In Indiana, we're actually a little ahead. Actually, I think it's 26 or 27%. I'll have Emily correct me on that. So I don't want us to get so caught up in the minutia of, and they're being very, very transparent. I've had more questions about the Johnson & Johnson vaccine. I'm like, you know what? You asked before, should we get young people first? Should we target target the pediatric population? Everyone just needs to get vaccinated. It's that simple. Think about this. Going to the Moderna, 6 per 7 million. Do you know what the risk in the general population of getting a PE or DVT? It's 1 to 1,000. You're 100 times more likely to get a clot of some type just walking around, even if you have no pre-existing condition. So it's important. I get that. I have some Caucasian female patients. They do enough research because of social media and Google. They don't want the Moderna. I'm like, you know what? I get that. I give you my spiel, and then just have me get a vaccine. Just get vaccinated. So, Brother John, to your question, it doesn't matter. Get vaccinated. And I don't feel as if I'm evading your question. My kids are 16, 18, and 32. And except from, the more I get vaccinated, the more I got vaccinated. Okay, so Milan gets vaccinated next week, and she's 16. So the pediatric question, that's not going to be an issue to me. The data will be available in December. We've heard the CDC, Fauci, and others speaking. Obviously, the big thing is to get kids back to school, and I see where your question is going. But as we know, in the school environment, that's why they opened up the schools earlier, because there's less likely. It's one thing just to get it, but for it to spread. So I'm not really worried about the pediatric population. I'm curious to see what Dr. Jeff and Dr. Devona have to say about that, because I see adults, and most of my kids, most of the patients I have are greater than 16. So that's my take on it.
Okay, all right.
One thing I might mention about, sorry, Pfizer. So right now it's the Pfizer vaccine that's approved for 16 and older. Yeah. And actually they're looking at applying for, right now, we're looking at, they may get that dropped to 12 within the next 2 to 3 weeks. So they're applying for emergency use authorization for Pfizer. And I know Moderna is doing the research too. But they did look at kids down to age 2. We probably won't be looking at vaccinating them or having any vaccine approved for them until probably 2022 sometime. So as adults though, if we all get vaccinated, we protect our children from getting it too. So that would be the other message to that.
And could I add to that, Emily, I'm sorry, I didn't interrupt. Brother John, you mentioned about the booster. Here, there's been a lot of scuttle in terms of everyone needing the booster, which I think is happening. Pfizer, their CEO was really the first person who officially mentioned, this is probably going to happen. They're still looking at that. And everyone has to remember this issue of variants. And it's where that is still ongoing. It changes from day to day. When you everyone knows that with the Pfizer and Moderna, they're the mRNA virus. They looked at a different population than the Johnson & Johnson, which, and part of the reason why their efficacy rates were lower, because they had some of the, I have a UK, I think it's 115 or 117, they don't use names anymore, it's a number, and then the South African or Brazilian variants. And so it's important to consider that we're pretty sure that these variants are covered, but no one can give you anything definitively. And so it makes sense that a booster or just revaccination, which is happening, is going to happen. That shouldn't be a surprise.
Okay. Ladies and gentlemen, if you're just joining us, we are on a panel here today to discuss how we can get the whole community of color vaccinated. within a timely manner to achieve herd immunity. We have doctors, we have experts in the field that are on the Zoom call with us. There should be, I am your moderator, John Grant, and I just want to bring back the purpose of the meeting. The purpose of the meeting is to get our community to believe in either or, survival, this vaccine, or education. So, talking about community and leaders in the community, I'd like to welcome Reverend Dr. William J. Smith, the residing pastor, Second Mission Baptist Church here in Kokomo, Indiana. Are you with us, Reverend?
I am here.
How are you today?
John.
I have a question for you as a community leader and getting this vaccine into our community's arms. Are we doing enough? What can we do as leaders or people that children and adults look up to in Kokomo? What can we do presently? Get the shot in front of them. Talk to them about the history of not doing anything.
Mm-hmm.
What's the rationale to get the engagement that we need to achieve herd immunity, at least in our community?
Well, I'm grateful to be a part of this panel, and I think that one of the key pieces is what we're doing now. Talking, and then the other piece is, and I can't remember who brought it up, but social media is just out of control. That with social media, you can say you can be an expert in anything. Anybody can be an expert. And so what has happened is that individuals, will form opinions and even share websites or share information. And I remember when the internet was coming out, that was one of the things that beware of anybody can put anything out there. So I think that it's very important. I'm listening to the doctors, and I'm Reverend Doctor, but I'm not a medical doctor. So I listen to medical professionals who are skilled in those areas. And I think it was brought forth also about the CDC. And there are individuals who are already and always researching various viruses and diseases that we haven't even heard of yet. And because that is what their skill, that is what their job. And I think that it's just very important for us to, one, make sure that we are regularly visiting and regularly have a relationship with a physician. That is key. Mm-hmm. Because when these things happen, if you also understand your health, you also are engaged with a professional who understands your health. And when these things happen, it's someone you can dialogue with. And also, I believe in this village concept, that it takes a village. And we often relate it to raising children, but it takes a village to do anything of significance in the community. And I think that, having all of the professionals that we have here, and even in our community who are working together, I think it's just valuable for us to listen and to spread that information. Those who are watching now, make sure you share it on your Facebook page. Share this information so that others who may not have the opportunity to watch at this time are able to go back and to understand what's going on in our community. One of the things that we as a church have allowed ourselves to do is to open our doors. That we had several weeks that we just allowed individuals who needed health assessments, needed to sign up for vaccination, just that question, being able to come to the church, setting up that opportunity. Also, I'm looking at the opportunity of in May, we're going May 20th through the 22nd. We are providing opportunity that will serve as a vaccination site. And it's just by us demonstrating and showing forth as a faith community the importance. And again, it takes all of us working together. I think that it will make a significant impact. I myself, I made sure I posted when I got my second shot. I made sure that I posted that information. Right now, I'm in the midst of, I had COVID-19. And so one of my things is that I'm working now to probably tell my story in some way, in some format, so that individuals understand my experience of going through this, because this is COVID-19 that we've gone through right now, but it may be something else later. And so understanding how we ought to take care of our bodies and making sure that we take an intentional responsibility to connect ourselves with the resources that are afforded to us.
All right. Well, you know what, Dr. Smith, the only thing we can do is stay relevant to the science, as you said. As things change, share the information, okay? And a relationship with the physician is essential pre-COVID. It didn't even matter. You should have been insured if you're able to be, and if you're not, go somewhere to be and get covered. And thanks to the Indiana Minority Health Coalition, they're on the call. They deal with the issue of insurance. We're going to take some questions. Thank you, Dr. Smith. We're going to come back to you, man, because we got to leave with prayer. We should have opened with one, but can we leave with one before we go? Okay, 1 second. All right. Robert Hayes has a question. He states, will we have to get another booster shot? And I believe we've covered that already. Dr. Breckenridge, you stated that, and Dr. Lance Washington stated that. If you'd like to just elaborate on that, if any of you guys are on the call, do you think that we're going to have to get one in the near future, next 6 months?
I think that at least at a year after our completed series, we'll probably end up getting a booster because of the variants. You know, we've known about coronavirus since 1964. And even when I remember taking microbiology, they said, oh, it's not that important. It just causes colds. Don't worry about it. That's why you see coronavirus on the Lysol bottle and all that, and the other disinfectants, because we've known about it for a long time. However, viruses mutate, they change. And the first serious change with the coronavirus was, as Dr. Backer said, it was with the SARS virus, which was the Chinese coronavirus. And then MERS, which was the Middle East respiratory syndrome. That was also a coronavirus. And so now we have the COVID-19 novel coronavirus. And so the coronavirus has mutated at least 4 times that we know of in the last few years. And it has, mutations don't usually bring out better change. They usually bring out worse change. And so the diseases have gotten serious. And so I anticipate we're probably going to need a booster in a year or so. It depends on how well the current vaccination covers the variants.
Okay, we have another question I want to get to real quick. Let's see here. Did I just zoomed out? Oh boy. 1 second. I'll get you back. What did I do here? Okay. What happened here? Can you guys hear me?
Yeah.
Yep.
I just can't see it.
Yep.
I don't know what I did. Let me fix that real quick. Okay. All right.
There you go.
All right. Okay. So I got one more question. Isaac White has a question. When did the FDA approve any of the vaccines? And I want to bring that up to Dr. Backer. Dr. Backer, when did they approve it? But mainly, when did they start to go with the research on it? I mean, because this was very quick. Research takes years before you even develop anything. So when did the FDA approve all of these vaccines? Because I know we started in January 2020, right?
Right. One thing I would say is that they are under emergency. They're approved under emergency use authorization, and you may see that, and that does mean that they did not go through the normal lengthy trials that a lot of medications and things do. But I mean, it's almost the instant that the novel coronavirus was, the genome was mapped, people started working on this. And what was unusual with these vaccines is, especially in the US, the federal government gave money to lots of different vaccine companies. Normally with a vaccine, you'll see one or two companies will say, okay, we're going to tackle Ebola, or we're going to attack rotavirus. And it's not worth it financially for all of them to try to make the same vaccine and only have one work. But in this case, there was such a need that I believe, and some of you guys, I believe there were like 180 different vaccines undergoing trials at one point, because there was so much effort and money, to be honest, thrown at this. And that was one reason that I think things were able to be sped up a little bit, is because there just was a lot more effort. There were a lot more people involved, a lot more companies involved. I think people realized how bad this was going to be, and things were sped up because of that. But if you look at the actual numbers of people involved in the trials, these were good size. Even with Pfizer, I think it was 36,000 people, got it before it was approved. 30,000 people got Moderna. So these were still good sized trials. It's just that they were condensed, but also because there were so many more companies involved in trying to make a vaccine that would normally happen. So that's one reason we were able to speed this up.
Brother John, could I just add to what
Sure.
Emily just mentioned?
Sure.
People have to understand. She already said eloquently that I get whether did this virus the vaccines just come out of the blue. We've known about mRNA technology forever. As Brother Jeff said, we've known about the coronavirus for decades. But what they need to understand, especially if we're looking at brown people specifically, it's so hard to recruit people of color to these clinical studies.
Yeah.
And my numbers may be a little off, but when we look at I think Pfizer was 30,000, Moderna was maybe 44. The numbers don't matter. What's important was that in these trials, like the Pfizer trial, 10% of the people who participated, and Emily, you can correct me if I'm wrong, 10% were African American, about 20% were Latino. Then when the Moderna, 10% African American, about maybe it was 13% that were Latino. It's nothing has ever happened at all. The approval, at least for Pfizer emergency, was just before Christmas. It's amazing. What God can do is He works through all these companies collaborating and getting us something so effective so quickly, and something that we would know we would work against people of color.
Okay, that goes to my next question. Dr. Devona Anderson, are you still with us?
I'm here.
I have a question from a person on the call. Have you seen, how has any of these vaccines affected pregnant women? Have you had any pregnant women patients that you've seen vaccinated, they've had some reactions to it? Have you seen that?
I have not, but what I do know is that, somebody correct me if I'm wrong, the last that I heard was they said if you want to get the vaccine, you were pregnant, you should just have a discussion with your physician and make a decision on whether or not you should have it. So they had done some studies with pregnant women, but I'm not sure if they were conclusive or not. I don't think there was anything terrible that happened, but they just wanted to have a shared decision making between you and your physician, if you decide to have the vaccine. Am I correct?
Yes.
Doctor?
Yes. It's been approved in pregnant women.
Yes. And they were even given priority because they realized that pregnant women had higher risk of complications with COVID. When they get COVID, they tend to be sicker. And so they actually gave pregnant women, before we opened it up to everybody, we actually give pregnant women priority over the general population to get it if they wanted it.
I have one more question too. You said that, Dr. Washington, you said 13% or 10% of the clinical study individuals that participated were African American. Is that nationwide or is that state by state?
No, that was when you look at a study, the way in which you study is 101. When you design a study, you pick the population you want to study, because obviously historically, unfortunately, a lot of these studies really just looked at just Caucasians, because it was very difficult to recruit people of color to these studies because of historical reasons and reasons we've have discussed. And but they took that was with, if I do believe in terms of the man, female, women. Lisa's trying to pull up the study, and I thought most of the participants were more American, but I thought it was worldwide. worldwide. I would have to get back to you, but most of the patients were American. I know with the Johnson & Johnson, that was more worldwide. But yes, it was a reasonable representation of us as African Americans or people of color. And I'd like to emphasize that this just isn't an African American problem, as we all say, but in terms of our concern, but also of a Latino or other patients who are brown, including Asians.
We're here.
The Indiana State Department of Health currently lists, out of all the people who've been vaccinated in Indiana, only 4.2% have been African American, and only 2.3% have been Latino. And those numbers are dismal.
Well,
yeah,
I'm not an expert panelist. I'm just a nurse, and Dr. Backer probably knows this better than I do. But at Indiana Minority Health, we have been following this through the COVID shutdown. And one of the things that we were told is initially early on, when they were giving out the COVID vaccinations, they were not always accurately collecting the demographic data. And I don't know if that's still true. Well, I'm going to say Emily, because she's a friend to me. And I don't know if that's been corrected. And I've been trying to get some data for Howard County, and I haven't been able to get a touch point on that. I do volunteer out at the clinic. And I will tell you, probably in the last maybe 3 weeks or so, I have noticed more African Americans coming out to be vaccinated. But definitely Indiana Minority Healthcare has worked really closely with the State Department, because we were concerned, because that is one of our charges at Indiana Minority Healthcare, is to work on decreasing some of these disparities. And so we really wanted to get our hands on what are we looking at, who isn't being vaccinated, and who is being affected by COVID, and what can we do to help or improve those numbers. So, those are some of the things that, Indiana Minority Healthcare is charged with. So I'm going to turn it back over to the other experts.
Oh, okay. All right. Thank you for your input. Thank you.
There is some similar data I did get, off the state website. They said that, the African-American population, I think, makes up about 9.4% of the population in Indiana, but they've only made up about 5.6% of the people getting vaccinated. And then the Hispanic or Latino, I think, is 6.2%, but they only make 2.9% of people getting vaccinated. Whereas if you look at Caucasians, it's 86% of the population, and they are 85.9% of the people getting vaccinated. Now, at my last state webinar, I think they are going to start to break that down by county. Right now, you can't get, I couldn't find any information on race within Howard County and what percentage, but I believe they said that they're going to start posting that next week or the following week. They're trying to get that. And I honestly don't know, Lisa, if they truly, I heard that too. I read that they said that they weren't collecting the correct demographic data on race initially. I don't know if they're going to be able to go back and do that or not, but I do remember that happened in the first weeks of it. So
well, I'm gonna be real with you. A lot of cats out here got issues with tickets and warrants and stuff. You got to show your ID and all of that. You know what I mean? If you could just give your name, take the virus, you get a lot more people vaccinated. I'm gonna be real with you, and that's male and female in Africa.
Yeah.
Okay. When you show me your ID, we believe we're gonna be tracked. We believe that we're gonna be tailed. We believe our information is going to be sold. Like Dr. Breckenridge said, we don't have faith in when the government's involved in saving lives. Right. And so either the requirements are going to have to. This is going to have to be something like when you go to your I'm Catholic. If I want to confess my sins, I go to the priest. We go into a secret box. Right. And in that secret box, I can tell him everything. And he's, by law, he can't tell nobody nothing unless it's going to damage somebody or put them in, So that's not only the only thing that we're afraid of. We want to make the process simple. I'm an American. I have a birth certificate. Here's my social security number. I don't want to show you nothing. Just stick me. When they make the process like that, and you could just take the last 4 of their social, their foot size, a thumbprint. You know, we're concerned about where does that go? Who's going to see that information? That's the problem with the age group from 30 to 50. That's the problem. I'm going to tell you that. We got another question that I want to bring up. Now, somebody asked Sanji, she asked, do you feel that this will ever be mandatory for us to have this vaccination? For example, kids can't go to public schools without some mandatory shots. So will this be put in the list of mandatory shots? And we have discussed that before with Dr. Backer and Dr. Backer. She can. What is the position of the state to make this mandatory for people in order for us to get the herd immunity? Do you see that coming?
Probably eventually, but like I said, as long as it is technically under this emergency use authorization, they can't force, nobody can be forced to get it. So it'll have to go back and go through the full clearance process before it can be made mandatory for public schools or anything like that. Now, employers can still make it mandatory if they want to. That's within their rights, private employers. I do look for it to probably eventually be mandatory for schools, but that may be several years. I don't know, because for one thing, we don't know if we've got the vaccine that we're going to settle on. You know, if we have to get boosters every year to keep up with variants, we may continue with this emergency use authorization over and over and not be able to, you know, certainly wouldn't be able to require it for school or anything like that. I would look to eventually it being part of the childhood vaccine regimen, but I don't think that's going to happen anytime soon, certainly not in the next year or two.
Okay, we have time for one more question, and I want to bring Dr. Reverend Smith back in because I actually want him to kind of head us out. I want to thank all of the doctors that participated, Dr. Emily Backer, Dr. Jeffrey Breckenridge, Dr. Devona Anderson, thank you. Dr. Lance Washington and Mrs. Washington, thank you so much. And the one thing before I give it back to the pastor to take us out, the one thing I want to know is, as a business owner, I don't know if people look up to me. I don't know if people listen to me. I do this because God tells me to do it. But what can I do in order to get somebody my age that might have, you know what, man, they put this in it, they put that in it. I mean, to me, I didn't have a problem taking the vaccine. Okay, I've done a lot worse to my body than the vaccine. You understand? I'm a smoker. Okay, but at the same time, the liberty feeling that I feel is, hey, they might say I'm asymptomatic. I could feel fine and still make you sick.
Yeah.
Right. Exactly. Now, how do we put that intellect into people, Dr. Backer? What is the best way? Hey, you know what? I do feel fine. Yeah, I don't need it, but you know, in order to save your life,
yeah,
what should I do? And what would your answer be to that?
Well, to realize up to 40% of people have no symptoms. So, you know, you may think I'm going to be fine, I'm young and healthy, but you know, how would you feel if you realize you spread it to somebody's grandma and they died, or even somebody's little kid? I mean, you know, people of all ages have died of this and gotten very sick.
Yes.
You know, so you could be responsible for somebody else's death, you know, or illness or hospitalization because you just didn't want to get the vaccine. And that's why I look at it. I mean, this is not just for you. This is for everyone around you. And this is for the stranger in the grocery store too. It isn't just your family, your church family, you know, your coworkers. It is for everyone that you benefit people when you get this vaccine.
Okay. I just want to take a couple more questions. Reverend, hang in there with me. Here's a question. What are the leaders in the medical community doing toward education in the children, the middle school, high school systems? Often peer pressure and parents who are afraid of the vaccine will prevent minors from being vaccinated. Dr. Breckenridge, I say to you, do you find that to be a problem? When the parent says, I'm not taking that thing, man, they use us as this and that, as guinea pigs. How do you break that stigma so we can get to herd immunity?
Yeah, you know, and that's part of our civil liberties in the United States, you know, is that people have the right to choose and have personal autonomy. However, when it comes to public health, you know, you get a lot of backbiting from that. In 1918, with the Spanish flu, they had anti-vaxxers. They had people who didn't want to wear masks. They had the same group of people that we have been experiencing today. So this is not a new phenomenon. Dr. Fauci eloquently stated, I don't know how to teach you how to care for what happens to other people. You know,
Right, he said that in his hearing.
You
Yep.
don't want you don't want to give this to your grandmother and live with the idea. I have a friend of mine who contracted it, and his mother was a liver transplant recipient, and she contracted COVID from him. And the guilt that he had, thank God she survived, but the guilt that he had, that he was the vector that brought the virus into his family. And I think we need to stress also, just because you survived COVID-19, you can get it again.
That's right.
Okay, I have many patients
Right.
in my practice here in Indianapolis who have had acute COVID-19 more than once. And the young couple I'm thinking of right now, they clearly stated to me they were sicker the second time they got it than the first time. And so just because you've had COVID-19, you do not have lifelong immunity. At best, we think it may last 90 days. And so vaccination is important for you. It's important for your loved ones, as well as the entire community. And so you want someone to protect your mother, your father, your grandparents, just like they want you to protect theirs.
Correct.
And so we have to start thinking outside our general, what the Greeks call our oikos, our point of contact, and think of more outside our community.
Excellent, excellent. Well, once again, I'd like to thank all the panelists for joining us. We still have more questions, so that means that we're going to do another webinar. That's what we're going to do. And if everybody that participated in this one will join us for the next one, we'll advertise it more so that we can get a bigger participation. Dr. Reverend J. Smith, pastor of Second Mission Baptist Church right here in Kokomo, Indiana. You've heard everything we've had to say. You've heard the experts speak. You spoke on science and how science and then the faith of man, how it has to blend together so that we can conquer this problem. What say you in closing this this meeting and your final thoughts?
Well, one of the biggest pieces is loving our neighbor. If we truly say that we love our brother, our sister, if we love anyone, we will get vaccinated.
That's right.
Also will allow ourselves to take the proper measures to protect ourselves and to look out for our neighbor. I look at any health condition, it's just the sense that you don't know who you're coming in contact with. You don't know what situation they may be dealing with. But I love you enough that I'm going to make sure I do all I can to ensure your safety and also the safety of your entire family. And I think that, it's just key for us to recognize that we just need to have that much love and that much respect for one another. It's all, even simple things of, hey, not just walking into a meeting and not having a mask on just because the mask mandate is no longer present, but by having to ask the question, are we all comfortable? That, are we comfortable at any level? And so recognizing, even as I said before, we have professionals who are able to give expert advice. Don't listen to everything someone says from a social media standpoint. Listen to those who are on the ground, who are sharing with us. We've just heard only, there's bits and pieces. I think it was Dr. Breckenridge shared something about that, about us having immunity, that after you've had COVID. I've heard so many times that, I'm immune. And someone has only taken a part of what was said on, maybe it was said on some news special, and not realizing the science behind, hey, you don't have lifelong immunity. So making sure that we get vaccinated, we take care of ourselves, and we have love and respect for one another. And making sure we any valuable information that we have. When there's information about the vaccination sites that was shared at the beginning of this call, sharing that information, letting others know, and telling our own personal story. that, hey, I've been vaccinated. And guess what? It was not a microchip.
Right. Yeah, that's another thing. I tell you, boy, I've heard everything from, well, the antibodies are from animals and this, that, the other. But the one thing that I do know about the Pfizer situation is the participation of African-American researchers in the Pfizer application. That's what took me by surprise, because we never hear of the heroes that are underneath the microscopes, that are checking the microbes, that are under the pressure to heal us. And for someone who doesn't understand the code of science, we rely on someone who does. I thank God for the fact that they had the inspiration to keep going in the middle of the night, 5, 6 in the morning, not being with their families. I think of the researchers, because I understand what it takes to engineer a movement. And it is so hard, and it's so easy to give up. And I want to thank all of our participants on the panel, Dr. Emily Backer, Dr. Jeffrey Breckenridge, Dr. Devona Anderson, Dr. Reverend William J. Smith, Dr. Lance Washington and his beautiful wife, and of course, the mayor of Kokomo, Indiana, Mr. Tyler Moore. Thank you for the Indiana Health Minority Coalition. Also want to thank, there's a list of people I want to thank. And if anybody's still recording, just know that I'm pausing real quick just to get everybody in, because this is so important to recognize the participants of people that put this together. Erica Pedroza, Public Policy Association, Associate for Indiana Minority Health Coalition. Thank you so much. Dr. Washington, again, thank you so much. Dr. Breckenridge, thank you so much. And if you guys could put up at the end of this meeting, your email and your Instagram or your social media, so people that chimed in can actually follow you, and so that you can drop little bits of knowledge as we proceed in getting our people vaccinated. Communication is the key. So if anybody has anything to add, I want to thank you guys for joining us on this important conversation.
Great job, John. We certainly appreciate what you've done, pulling everyone together, and just a list of questions. I know you had asked me to send you some questions, but my goodness, you have enough questions for now until tomorrow for the most part.
Well,
but
thank you.
We certainly appreciate all the participants and just the whole panel. And like John says, it's time to continue this communications as we move forward with what we're trying to do to let the community know that we care. And that's why this webinar was put together, is because we care, and we got to defeat the virus.
Also want to thank the fraternity Omega Psi Phi, my Q dogs stepping up in the community, man. Always have my brothers accused, and always first on the line, man. Appreciate y'all, man. And all I can say is this: as a radio station, when you guys want the floor, you have it. Dr. Washington, you know, you treat my wife. Eventually, you're going to treat me. You have carte blanche to come in here and talk with me. You know what I mean? I got masks. I've got Super Lysol. You know, the dog has been vaccinated. But I'm here for the community and all the doctors that are on this call. If you have anything you want to say to the masses, and if I can be of any help, please stop by, give me a call, give Willie a call. Willie has my information, man. This was such a great honor to talk about how we can help each other. And let's do it again. All right.
Thank you, John. Thank you. We'll give it back to the pastor at this point, so we can close this out.
Yes.
Thank you very much.
Pastor Smith, it's on you, brother.
Okay, enjoyed this. Let us pray. Gracious God, we come to you. We thank you for this opportunity for us to gain valuable information. We thank you for those who have listened and those who will continue to listen and watch. And God, we just thank you for these leaders in our community. Continue to bless them in their capacities as they serve our community. And dear God, we just ask that, Lord, you would just continue to bless us as a community and bless us as a nation, bless us in our world, Lord, that we might continue to move forward and being productive citizens and allowing ourselves to be healthy. And we thank you for continuing to help us and guiding and shaping our community and taking care of our bodies. It's in Jesus' name we pray. Amen.
Amen. Willie?
Amen.
All right. Thank you very much. Thanks, everyone, again. We certainly appreciate it. Have a good evening, and we will be in touch. Thank you. Bye-bye.
Thank you.
Bye.